Yeah, good evening to all. Good evening, good evening. Yeah, good evening, Navyashri. Good evening, Vinita. Yes, good evening, Netravati. Yes. So kindly share the link. So in your groups. So let us start with today's session. In today's class is going to be a very important session. All the topics which I am going to discuss today are golden topics, and yes, now tell me how you people are doing for your exams. How are you people doing for your exams? Okay, okay, pirates, okay. Happy to see you here. And good evening, Gayatri, Venkat, Srikant, Divya Mohan. Yes. Kindly share the link to your friends also, so let them also join for the today's class. Yeah. So yes, అన్ని ఎగ్జామ్స్ అయితే ఉన్నాయి, రెడీగా ఉన్నాయి. సో ద వన్ విచ్ ఈస్ లెఫ్ట్ ఓవర్ ఫ్రమ్ యువర్ సైడ్ ఈస్ ప్రిపరేషన్. సో ESIC and many exams, NORCET, many central government exams are ahead in front of you, and the one which is left, the one which you have to give is hard work and hard work at your level best, at your level best. So yeah, good evening, Nagamani. Good evening. Good evening to all. Do watch my rapid revision part 1 also. All the topics which I have discussed from F1, they are golden topics, they are must studies topics for your exam, and without studying these topics, please do not appear for your NORCET exam. And yes, I think I am audible to you all, right? Whether I am audible to you all? Just tell me yes or no if I am audible. Okay, Navya is telling yes, sir. Okay. Yeah. Thank you, Navya, Vinita. Thank you so much. Okay, okay. Thank you so much. So preparation is same. See here, my dears, preparation is same for all the exams. Okay. If you are preparing, మీరు నార్సెట్కి ప్రిపేర్ అవుతున్నారా, లేదంటే ఈఎస్ఐసికి ప్రిపేర్ అవుతున్నారా, లేకుంటే ఎస్జిపిజిఐకి ప్రిపేర్ అవుతున్నారా, అండ్ that doesn't matter. See, exam and content and subjects are same everywhere. And the one is the time scheduling your time and giving a proper strategy is very important to crack any exam. Okay, so do follow my I have already discussed the planner study plan for this last few days for your NORCET exam. Do watch that video, prepare your study plan. Similarly for ESIC, let me do one more video for ESIC. Let me give you a study plan for ESIC. I think for ESIC you have time, but NORCET, yes, in April, be ready for giving NORCET exam. Okay, right. Yes, Swarupa, good evening. Okay, so without wasting the time furthermore, let me start with today's class. So all your doubts, I'll address all your doubts the last of my session. So you can just comment your doubts in the comment box, and I'll be addressing them at the last of my this live session. Okay, and I want all of you to take the registers, continue taking the notes from your part 1. Okay, so this part 2 each and every topic is a golden topic, and every topic should be properly studied before your NORCET or any exam which you are appearing for. Okay, so let us start. So starting with the airway management. Okay. So yes, so so all your doubts I'll be addressing at the last of this live session. So now let us study the topic. Okay, right. See here, starting with airway management. Okay, so listen to me properly. Here now I'm giving you two cases. Okay, now I'm giving you two patients. So you have seen now you are the nursing officer working in a hospital, and you have noticed a patient whose GCS is 8, whose GCS is 8, and one more patient you have seen who is unable to speak and who is in respiratory distress. Yes, what is the management in these both of these cases? What is the management? By the time I say these scenarios, you would have got something in your mind, right? What did you get in your mind? Yes. Can you people tell me what did you get in your mind? Excellent, excellent Divya Mohan, excellent Menaga. It's intubation. Yes. So airway already displays. Yes, it is ET intubation, Aparna. Yes, you are right. Your guess is right. See, I have given you two cases, right? In both of these cases are the indication for ET intubation. You have to intubate. You have to secure the airway first of all, right? So let me write it down here. So what you will do here in these cases, yes, these are the indications, these are the absolute indications for ET intubation, right? You need to intubate the case, right? So it is an absolute indication for ET intubation, right? See here, guys, properly listen to me. Just a minute, sir. Me explanation, okay, content me. It will be very helpful. So okay, I'm trying my level best to take sessions, but I don't know when I'm going to start in a full-fledged way. Like online platforms, I'm not running any online platforms as of now. Only I'm going with my YouTube channel, and so do watch my videos on my YouTube channel, and very soon, I don't know, very soon I cannot say, I may be starting with other few plans. Okay, that's in future. Let us see in future. Okay, for my full-fledged lectures. Okay, so as of now, just listen to go through my YouTube lectures. Okay, right. Okay, right. So now forget about everything. You people don't ask me any doubts now. Let us discuss all this technical and non-technical. Everything we'll be discussing it in last of this live session. I'll be giving you time for your doubts. Okay. So now just listen to the class with full concentration. Okay. Right. Right. Okay. So now I have given you two scenarios. That's an absolute indication to intubate. Right. So ET intubation need to be done. See guys, ET intubation can be done in two ways. You can intubate these patients in two ways. One is just a minute. Let me make my mobile right. Okay. So one is you can, if you take the ET tube and insert into the oral cavity via the oral cavity into the trachea, it is called as orotracheal intubation. It is called as orotracheal intubation. Okay. And similarly, if you insert the tube via the nasal cavity into the trachea, it is called as nasotracheal intubation. Okay. It is called as nasotracheal intubation. The one which is preferred, orotracheal intubation or nasotracheal intubation, which is preferred? The one which is preferred is this one, orotracheal intubation. The one which is preferred is orotracheal intubation. Okay, right. Okay. So in my very first class, if you remember my very first class, the ET intubation and tracheostomy I have discussed in detail there, right? So if you have watched that video, there I have told you, right? So whenever you want to do orotracheal intubation, so you need to perform laryngoscopy, right? You need to perform that direct laryngoscopy, right? To visualize the vocal cords and insert the ET tube, right? So in order to perform laryngoscopy, yes, you need to provide sniffing position, right? You need to provide sniffing position or barking dog position, I have already told you, right? So in a patient with cervical spine injury, you are not supposed to move the neck of the patient. So you cannot provide sniffing position. That means you cannot perform laryngoscopy. That means you cannot intubate, right? That becomes unable to intubate. So if you are unable to intubate the case, if it is unable to intubate the case, unable to intubate, or there is failed intubation. What do you mean by failed intubation? Can anybody tell me what is failed intubation? Let me see the live chart. Okay, let me see. Tell me. Failed intubation. What do you mean by failed intubation? What is failed intubation? Let me see who is going to say, tell me what is failed intubation. See, let me tell you, a maximum of 3 + 1, 4 attempts is given. Still the anesthetist is unable to intubate. Anesthetist or physician is unable to intubate. That is called as failed intubation. Okay, maximum 3 + 1, 4 attempts is given, and still the patient is it's unable to intubate the case. Yes, that is called as failed intubation. So whatever it may be, it is if you are unable to intubate, or in case of failed intubation, the next best step will be you can go for an emergency procedure. Since the patient needs airway, you need to give some oxygen source to the patient. You are unable to intubate, yes, the patient you need to secure the airway. You can go for an emergency procedure that is called as needle cricothyroidotomy. Okay, what is this procedure called? Needle cricothyroidotomy. So I'll tell you what is this procedure just now. Okay, listen to me. See, if you are unable to intubate the case and if there is failed intubation, then the next step is you can go for an emergency procedure in order to provide oxygen to that patient, right? Otherwise the patient can go into hypoxic arrest, right? So you need to give oxygen to the patient. So you can go for an emergency procedure called needle cricothyroidotomy. Needle cricothyroidotomy, how it is done? See, similarly as IV cannulation, you will take a 16 gauge IV cannula. 16 gauge IV cannula, what color it is? 16 gauge, G for gray, okay, G for gauze, Z for gray, okay, 16 gauge ka needle IV cannula you will take, and then you will palpate the Adam's apple. So Adam's apple will be palpated here, and just below the Adam's apple, cricothyroid membrane is present. Okay, cricothyroid membrane is present, and you can insert this IV cannula into that cricothyroid membrane, and you will enter into the airway. Once you enter into the airway, you will remove that needle from the IV cannula, and you will connect that catheter to the high flow oxygen source, to any high flow oxygen source. Okay, and this procedure, which is needle cricothyroidotomy, this procedure is useful for maximum of half an hour, 30 minutes, not more than that. And more than that, if you want to have, you should go for a definitive airway. What is a definitive airway? Definitive airway is tracheostomy. Okay, tracheostomy, pin to pin details regarding tracheostomy I have detailedly explained in my very first video, that is ET intubation. You can find that video in my channel. It is available readily on my channel. Go watch that video. And those who are watching this video, kindly like this video. Okay, do click on that like button so that this video will be suggested to all your friends who are preparing for your central exams. Okay, in that way you will be helpful for your friends. Okay, right. So again I am telling you this one. For example, okay, there is a patient who requires intubation. Okay, so by two ways you can intubate the case. Okay, if you insert the tube via the nasal cavity into the trachea, it is called as nasotracheal intubation, and if you insert the tube via the oral cavity into the trachea, it is called as orotracheal intubation. The one which is preferred is orotracheal intubation. Okay, so in order to perform orotracheal intubation, you need to perform laryngoscopy, and to perform laryngoscopy you need to give barking dog position or sniffing position. Okay, in a patient with cervical spine injury, you cannot move the neck of the patient. Okay, then you cannot intubate, that becomes unable to intubate, right? So if you are unable to intubate, or if there is failed intubation, okay, the next step you can go for an emergency procedure which is called as needle cricothyroidotomy, where IV cannula, 16 gauge IV cannula is taken and it is pierced into the cricothyroid membrane, and it is connected to the high flow oxygen source, and this is called needle cricothyroidotomy, and this procedure is useful for a maximum of half an hour, right? And then you need to go for a definitive airway. The definitive airway is, the final definitive airway will be tracheostomy. Okay, and all the details regarding tracheostomy I have discussed in my very first video. Go check out that video for the same. Okay, and one more important point that you need to remember is needle cricothyroidotomy is contraindicated in children. Okay, it is contraindicated in children less than 12 years of age. Okay, right. So now tell me, what is this? You're clear with this till here? Okay, just go with these images. I think it is, the screen is okay, Likit. I think check your internet connection from your side. It's going fine in my mobile. Okay, right. See here. Yes, what are these images which I am showing here? Yes, what is this image? This one. Yes, all you people are right. Yes, everyone are answering rightly. It is called as OPA, which is also called as Goodell's airway, and the B image, which is NPA, nasopharyngeal airway. You people rightly answered this. Okay, see, what are the uses of these airways? These airways can be shown as image based questions in your exam, and they can ask you MCQs regarding this. Okay, so OPA, which is also called as Goodell's airway, and NPA, nasopharyngeal airway. What are the uses of these airways? See here. OPA, it is mainly used in unconscious patients, and NPA is used in conscious patients. Sir, why OPA cannot be used in conscious patients is because, see here, OPA is absolutely contraindicated in conscious patients. Why? Because in conscious patients it will stimulate gag reflex. So that's why OPA is not inserted in conscious patients and NPA is inserted in conscious patients. Okay, so this one you should remember. Okay, right. What are the purposes of this? What is the main purpose of this OPA, NPA, whatever it may be, the airway? Just tell me. See, the main purpose is to airway device, something it will maintain the patency of the airway, common sense, right? So it also prevents the tongue falling back. For example, a patient who had received general anesthesia, there are high chances of tongue falling back and it can block the airway, right? So in order to prevent that, this airway can be inserted. Okay, and in like there are other indications also, like in seizures you can insert this, so that prevents tongue bite. Okay, right? Tongue bite, and those who are intubated, okay, they'll be biting this ET tube. So this OPA will have blocks, bite blocks, and that will prevent the patient biting the ET tube. Okay, there are many other uses of this OPA apart from that, which one I have, which the first one which I mentioned. Okay, right. So any doubts still here? So the main purpose is to, it will maintain the pattern, both the airways will maintain the patency of the airway, and it will prevent the tongue falling back. Okay, right. So no doubt still here, and I'm going, okay. Yes, thumbs up for those who are not having doubts, and let me proceed with the other slide. Okay, see here, okay, just now I have shown you OPA, right? And now tell me how OPA size is selected. How you are going to select the OPA? Okay, there may be different age groups, and depending upon the age group, how you are going to select this OPA? Tell me. See here, OPA, you will take the OPA and measure it from the midpoint of the incisors till the angle of the mandible, and that becomes the exact size of that patient. Okay, so you will take the OPA into your hand and you will just measure it from the midpoint of the incisors till the angle of mandible, and that becomes the measurement of OPA, and that is the appropriate size for that patient. Okay, so let me write it down. Measure it from the midpoint of the, no doubts, right? Okay, midpoint of the incisors till angle of the mandible. You will measure it, and that is the appropriate size for that patient. Okay, that's the measurement of OPA. Now, starting next topic is O2 delivery devices. Okay, so O2 delivery devices, again, there is no paper without O2 delivery devices. Okay, whatever it may be AIIMS, SGPGI, ESIC, RRB, whatever it may be the exam. So they are going to ask the questions from O2 delivery devices. Okay, right. So now you people should answer, what is this? What is this image? What is this image? Yes, nasal cannula. What is this? This is nasal cannula, which is also called as nasal prongs. This one, image B. See, there is a mask, okay, which is a simple face mask, or which is also called as Hudson mask. Simple face mask ka other name is Hudson mask. Okay, and what is this image? This C. This is, yes, there are multiple. You have, see here, you have multiple valves which are colored, right? So this is, what is this? This is Venturi mask, no doubt in it. And now, what is this? There is a bag for mask, mask with an attached bag, right? What is this? NRBM, non-rebreather mask. Okay, and this one, what is this one? This bada structure kya hai yahan pe, right? This is HFNC, high flow nasal cannula, right? How to identify this one, HFNC? There will be a humidifier. Okay, there will be a humidifier for this, and you can adjust. The flow meter will be there, and nasal cannula will be there. Okay, this is high flow nasal cannula. Okay, and the last one, yes, you people know this. What is this? NIV, non-invasive ventilation, right? Okay, these are all the O2 delivery devices that you people can, they can ask you. For sure you're going to get from this in your exams. So I want all of you to listen to this. Okay, right. See, when I say about oxygen delivery devices, Okay, there will be low flow devices and high flow devices. I think you are all familiar with this, right? Let me tell you what are low flow devices and what are high flow devices. Low flow devices are your nasal cannula, nasal prongs, nasal cannula and nasal prongs, it's one and the same, and your Hudson mask and the NRBM, non-rebreather mask. Okay, mask with or without bag, it is a low flow device. Okay, and high flow devices are Venturi mask, HFNC and NIV. Okay, the CPAP or whatever it may be, the CPAP. Okay, so these are high flow devices. Okay, so take all the notes which I am writing it down here. Everything should be copied into your notes. Okay, each and every topic each and every slide which I am writing here is a golden topic for your exam. Okay, all these are must study topics for your exam. Okay, so let us see why are we studying oxygen O2 devices. Okay, they may not be showing you face mask and they'll nasal prongs, and they'll not ask you to name those images. That's very basic stuff, right? But what are they going to ask from this O2 delivery devices is flow rate and FiO2. These are very, very important. Okay, for nasal prong, now you people are going to answer me. Fadafat se give me the answers for all these O2 delivery devices. What will be the flow rate and FiO2? What is the flow rate of nasal prongs and FiO2? Can anybody tell me? Maximum how many liters can be given? How many liters per minute can be given in via the nasal cannula? Yes, 2 to 4. Okay. Yes, Venkat, somebody, if you, yeah, okay. So let me write it down. See, nasal prongs, the flow rate of nasal prongs, I want all of you to take this table. Okay, right. See, nasal prongs, it is 6 liters, still 6 liters per minute you can give. Via the face mask, 10 liters per minute. For Venturi mask, it is 15. And for NRBM, again, it is 15. Okay. And for HFNC, maximum flow rate that you can set is 60 liters per minute. Okay, in HFNC, in high flow nasal cannula. And NIV, it is unlimited, right? It's a ventilator, right? Unlimited. Flow rate is unlimited. Okay. For FiO2, what is the maximum concentration of oxygen that can be given via the nasal prongs is? So let me come from NIV. NIV, yes, it is 100%. HFNC, high flow, yes, again it is, the name itself says it is high flow, right? 100% of oxygen can be 100% of FiO2 can be given via the HFNC. And NRBM, 90% till 90% of FiO2 can be given by the NRBM, that non-rebreather mask. And Venturi mask, it is 60%, and face mask, again it is 60%, and nasal prongs, it is 40%. Okay, right. See, one that they are very familiarly that they are asking in exams is this one. Okay, NRBM, you people will definitely confuse with NRBM. You people will name it as high flow device. NRBM is not a high flow device. It is a low flow device. It is a low flow device which can deliver high concentration of oxygen. High concentration of oxygen. Okay, you people will definitely confuse this in your exams, and you people will select the option there as high flow device. NRBM is a low flow device which can deliver oxygen. It can deliver FiO2 of 90%. That's only the low flow device with high concentration delivery. That's only the low flow device with high concentration delivery, NRBM, non-rebreather mask. Okay, right. This is repeatedly asked, and they can also ask the other things. Okay, I want all of you to by heart this table. Okay, right. Okay, next there are few one-liners. I want you people to answer this. Okay, right. Now you people are going to answer these questions. Okay, right. Yes, tell me. Okay, now tell me choice of oxygen therapy in COPD patients. COPD patients में choice of oxygen therapy क्या है? Nasal prongs. No, I'm not asking which oxygen device you will be selecting, oxygen delivery device you will be selecting. The choice of O2 therapy in COPD patients. Yes, Nirmala rightly said. Minaga also rightly said it is Venturi mask. Okay. See, Venturi mask is a fixed performance device. Okay. Do write it down in your notes. What is Venturi mask is? Venturi mask, so if I set at a specific concentration and specific liters, it will deliver only that. Okay. Okay, there is no chance of hyperoxygenation in Venturi mask. So that's why in COPD patients, to prevent hyperoxygenation in them, you need to give very oxygen at very low volume you need to give in COPD patients. So that's why, okay, Venturi mask is the choice of oxygen therapy in COPD patients. Okay, so Venturi mask, the speciality of Venturi mask I've already told you, right? So it can deliver a desired quantity of specific concentration you can deliver. Okay, so whatever you said, that alone it will deliver, that Venturi mask will deliver. So no chance of hyperoxygenation. So in order to prevent hyperoxygenation, yes, the best option will be Venturi mask in COPD patients. Okay, right. What is the percentage of oxygen present in environmental air? Percentage of oxygen that they are asking. It's a basic question. I think all of you to know this. It's a 21%. Yes, Nirmala, Ranjit, Minaga, yes, you people are right. It is 21%. Okay, and here they are asking you what is a device that can deliver a fixed concentration of oxygen. Okay, here they are asking you what is that oxygen delivery device that can deliver at a fixed concentration of oxygen. Yes, I've already told you, you people are going to give me the answers. Excellent, Vinita, quick answer from Vinita. It is Venturi mask. Okay, that is the speciality of Venturi mask. Okay, whatever you select, that alone it will deliver. Okay, only fixed concentration it will give. Okay, right. So 2 liters, yes, 2 liters. Okay, that's it. Okay, so low flow device. Yes, you people are right. Nandini, Likith, Gina, yes, you people are right. It is Venturi mask, which is a fixed performance device where fixed concentration of oxygen can be given. Okay, if you want to give, yes, if you want to give, for example, if you want to give 40% of FiO2, yes, it will deliver that alone. Okay, that's the specialty of Venturi mask. Yes, you people are right. Don't answer NRBM. If they ask, see, NRBM, okay. For next question you are answering, right? Okay, you people are right. Those who are answering NRBM, yes, you people are right. For this question, the low flow device that can give high concentration of FiO2 or high concentration of oxygen is, please don't confuse NRBM with high flow device. It is not high flow device. It is a low flow device with high FiO2 delivery. It is NRBM, non-rebreather mask. Okay, right. Okay, so now what is this image I am showing? What is this image? Tell me what is this image? This is a basic question. Okay, ambu. This is an ambu bag, right? So now tell me how much FiO2 you can deliver by ambu bag. Now tell me how much oxygen can be delivered via the ambu bag. Yes. Till 100%, from 21% to 100% of FiO2 can be given via the ambu bag. Let me de-escalate it. Okay, see here. if you see, there will be ports here, one port for oxygen and this one is for reservoir. Okay, so without oxygen source and without reservoir, if you only just give ambu to patient, it will deliver 21%. That room air alone it can give, that's 21% of oxygen will FiO2 will be achieved. So if you add O2 source, if you connect the ambu bag to the O2 source, then it will deliver a maximum of 60% of 40 to 60% of FiO2. And ambu plus O2 source plus reservoir also, if you attach, it will deliver 100% of FiO2 to the patient. So whenever you give ambu, make sure that you are connecting it to the oxygen source and reservoir is attached to that ambu. Then only it can deliver 100% of FiO2 to the patient. Okay, right. So don't, this is also very important. I want all of you to know this. Okay, right. Okay, so now completed with the, till here you are clear, right? Completed with O2 delivery devices. Next, let us go to the other topic. Okay, see other topic. Yeah, so coming to the vaporizers, anesthesia vaporizers color codings. I am going to discuss the color coding here. Again, there is no paper without color codings. One or two color codings will be asked from okay, from the today's class which I am going to say. Okay, anesthesia vaporizer color codings are very important. Okay, see, I think if you would have attended my previous classes, in my previous classes I have already told you a mnemonic, right? What is that mnemonic? Dish is the name of that person. Okay, you are saying to the dish, Mr. Dish, be polite yet respective. So this is the mnemonic that you will remember for this anesthesia color codings. See, just take these letters, the first letters here. So D for desflurane, I for isoflurane, S for sevoflurane, H for halothane. Okay. So these are the color codings. Be polite at respective. These are the color codings. Take the first letters and that becomes the colors. B for blue, P for purple, Y for yellow, R for red. R for respective, R for red. Okay. So take this first letters. Okay. Right. So desflurane blue color, isoflurane purple color, sevoflurane yellow color, halothane red color. Okay, these are the color codings. Yes, they are going to ask again at least one you are going to get in your exam. Okay, and let me also tell you this few more points on this anesthesia gases. See, in cardiac surgery which is preferred is isoflurane. The one which is preferred in cardiac surgeries is isoflurane. The one which is preferred in hepatic surgeries is also isoflurane, and in case of children's, the one which is preferred is sevoflurane. Okay, S for sevoflurane, S for sweetie order. Okay, why sevoflurane is preferred in case of children? Because the sevoflurane has sweetie order. Okay, so S for sevoflurane, S for sweetie order, that's why it is preferred in case of children. Okay, so these are few points that you need to remember for your exam. And now starting with our medical gas cylinders. Okay, medical gas cylinders. What is this? A, B, C. What is A here? What is this? Which gas is filled in this blue cylinder? Yes, nitrous oxide. Okay, nitrous oxide. And this one, option B. Yes, all people. Yes, Miss Estrogen, you are right. Yes, Vinita. Yes, you people are right. Those who have answered it as nitrous oxide, you people are right. So anything blue, that is nitrous oxide, and anything white and black, It is always oxygen. Do not confuse. Tomorrow in exam, if they are giving you an image with white and black cylinder, just close your eyes and mark it as O2 cylinder. Okay, right. Yes, the black and white are O2 cylinder. Yes, Aparna, Prashant, everyone of you are right. Okay, and C, the gray color. What is gray color cylinder here? Gray color. Gray is for, yes, excellent Vinita, it is carbon dioxide. Okay, so blue is for nitrous oxide, white and black is for O2 cylinder, and carbon dioxide is gray. That you this anyone at least they can ask you in your exams. Okay, right. Yes, Ranjit, yes, Daniel, you people are right. Okay, right. So now hospital disaster codes. Okay, and I think in this NORCET exam one hospital disaster code will be asked. Okay, I want all of you to take this along with me into your notes. Okay, so blue so blue code, I think all of you are familiar with this blue code activated in ICU. Yes, what does it mean? Blue code activated in emergency, what does it mean? Yes, cardiac arrest. किसी को कार्डियक अरेस्ट हो गया एंड ब्लू कोड एक्टिवेट हो गया. इट्स नॉट ओनली कार्डियक अरेस्ट एंड इट मेडिकल इमरजेंसी. Okay, in case of medical emergency in cardiac arrest, it is blue code. What is red? Red is for fire. Okay, pink. Pink is for baby missing. Okay, this is for mainly pink. कौन होता है pink? So ఎవరు ఉంటారు పింక్ గా? బేబీస్ ఉంటారు కదా, that's how you will remember. So pink is for baby missing. Okay, so this is mainly for those who are working in pediatric wards. Okay, any baby miss ho gaya, so immediately you will activate pink code. So right, next is orange. Orange is for spill management. Spill management. B for black, B for bomb threat. So किसी ने bomb threat किया है, then you will go for black code. You will activate the black code for bomb threat. And P for purple, P for people. People will fight, right? So internal fights. If any fights are going on within the ward or whatever it may be, purple, you need to activate the code called purple. Okay, and yellow. Yellow is for external disaster. External disaster. Gray for internal disaster. Gray for internal disaster. Okay, so let me repeat it once again. So blue code, very very important. So all these 5, within this 5 you will get one question. Okay, within this 5 you will get one question. Okay, purple, yellow, gray, forget about it, but blue, red, pink, orange, black, it should be on your fingertips. Okay, so blue it's a cardiac arrest or medical emergency, red is fire, and for pink evaru untaru pink baby, so baby missing, it's for pink code. Orange is for spill management, B for bomb threat, B for black. Okay, so these are the hospital disaster codes that you people should remember for your exams. Okay, next coming with the biomedical waste management. Again, it's one of the very very familiar topic for the examiners. Okay, there will be no question paper without biomedical waste management, right? Okay. So there will be no question paper without BMW. I want all of you to take this. Okay, right? Okay, so I will address all your doubts at the last of this live session. Till then I just watch this lecture. Okay, right? So okay, now what all you are going to do? So there are 4 colors that you should remember whenever I say biomedical waste management in hospital. 4 colors you need to remember. Okay, one is yellow bin, the other one is red bin, the other one is white, PPC, puncture proof container. Okay, and the other one is blue cardboard box. Okay, these are the things that you need to remember for your exams. Okay, see what all you are going to discard in yellow bin. So let me be fast in answering this. So yellow bin, what all you are going to discard? Whenever I say yellow, yes, it is anatomical waste, human anatomical waste. Human anatomical waste like placenta, fetus, किसी को abortion किया and fetus, you can discard it in yellow bin. And किसी को biopsy किया and if you want to discard the tissue in tissue, you will discard it in the yellow bin. Okay, tissues. Okay, and what else? Lab waste. All the cultures, you will discard it in the yellow bin. And chemical waste. Chemical waste like disinfectants, if you want to discard, you will discard it in the yellow bin. Okay. Next, what else you will discard it in yellow bin? What else you will discard? Yes, expired medications. Expired medications, or if you discarded medications. Okay, and vaccines, very very important. Vaccines, if you want to discard, yes, it will, you need to discard it, the leftover vaccines in yellow bin. Okay. And apart from that, you will discard your blood bag. Blood bag will go into yellow. Blood will be red in color, it will go into opposite color. Okay, blood a color lo untundi, red ga untundi, so it will go into an opposite color, remember like that. Okay, so blood bag will go into yellow bin. Okay, right. Blood bag and dressings. So all the dressings, and very very important, cytotoxic waste. All the cytotoxic waste, whatever it may be, whatever it may be, cytotoxic waste in the sense it might be glassware also, ampules, okay, vials, chemotherapy ampules, vials, or even the plastic bottles, all, even if it is plastic, yes, you need to discard it in the yellow bin. Okay, right. All this will go into yellow bin. Now coming to the red bin. What all you will discard in red bin? Yes, you will discard, what all you're going to discard it in red bin? I think you are all familiar with this. Yes, answer. Glassware, PPC, Aparna, glassware, all the broken ampules, vials. I'll tell you. Just wait. Okay, right. I'll tell you. Now let me complete red. Okay. So see, yellow have completed, red bin. What all you will be discarding in the red bin? See, R for red, R for recyclable. Recyclable. Okay, R for red, R for recyclable. All the waste that can be recycled will be discarded in the red bin. That means your plastic and rubber, you will discard it in the red bin. That means what all comes in plastic and rubber? Yes, your NG tube, your catheters, urinary catheters, syringes without needle. When I say syringe, it is without needle. Okay, and needles will go into PPC. Okay, and IV tubings, vacuumers, and gloves, plastic apron, and what else? What else you will be discarding it in the red bin? One more important, urine bag. Okay, so urine is yellow in color, it will go in opposite bin, opposite color bin. That means red bin. Okay, blood bag will go to yellow color, urine bag will go to red color. Okay, so that you remember this. Okay, right. All this will be discarded in the red bin. Okay, next coming to PPC. What is PPC? Is puncture proof container, which is white box. Okay, and see here they have written already here, right? Okay, sharps waste only. What are all the sharps? What are all the sharps? Needles. All the needles you should discard it in the PPC. And scalpels. Okay. And syringes with prefixed needle, insulin syringe, enoxaparin syringe. If you have seen enoxaparin syringe, it is a syringe with prefixed needle. You cannot separate the needle, so you should discard the entire structure into the PPC. Okay, syringes with prefixed needle. Okay, example, enoxaparin needle. You'll directly discard along with the syringe. You'll directly discard into this PPC. Okay, right. So all the sharps you will be discarding it in the PPC, puncture proof container. Okay. Now what all you will be discarding in blue box? Blue. When I say blue cardboard box, yes, in blue cardboard box you will discard all the glasswares. Okay, all the broken ampules, okay, vials, and all the glassware will go into blue cardboard box, and along with that metallic body implants will go into blue cardboard box. Okay, so no doubt here, right? Okay, so now I think I'm clear with your doubt. So previously somebody is telling you will discard the glassware in PPC. No, glassware will be discarded in blue cardboard box. Okay, this white PPC is for only sharps. Only sharps you are going to discard it in the PPC. All the needles, scalpels, syringes with prefixed needles, everything will go into PPC, that white box, and remaining all the broken ampules, vials, whatever it may be, the glassware will go into blue cardboard box. Till here I am clear, I think so, right? So no doubts, right? So should I want to repeat it? If I want to repeat, I'll repeat. If not, I'll proceed with the next slide. Glassware, see here my dears, glassware will be discarded. See, glassware will be discarded in blue cardboard box only. Okay. Okay. Right. So now answer for these questions. So let me address your doubts at the last of this session. Let me complete this present slide. Okay. General waste I am not discussing here. Okay. General waste I am not discussing. Only hospital ka biomedical waste management I am discussing. Okay. General waste we have blue bin and green bin. Blue for dry and green for wet. So that I am not discussing. That is solid waste I am not discussing here. Only hospital biomedical waste management I have discussed here, right? Okay. So now tell me where you are going to discard this pacemaker. If at all in tomorrow's exam they are asking you where you are going to discard pacemaker. Yes, tell me. Yes, tell me. Yes, pacemaker, it's an implant. It's just like your implant, right? So you will discard that pacemaker in blue cardboard box. Blue cardboard box. Copper T. Where you are going to discard copper T? Copper T, again it's an implant. Yes, you people are right again. It is blue cardboard box again. Okay. And metallic, all the metallic implants, no doubt it will go into blue color. Okay. And urine bag I have already told you, urine is yellow in color, it will go in an opposite color, red bin, right? So urine bag, in the sense entire urine bag along with urine, it should not be discarded in red bin. Okay, sorry, red bin. Okay, so urine should be, you will make sure that it is getting discarded in the deep drain system in sluice room, and then the urine bag will be discarded in the empty urine bag will be discarded in the red bin. So blood bag, blood is red in color, it will go into an opposite color, yellow color bin. Okay. NG tube will be discarded in, yes, it's made up of plastic, yes, all recyclable waste is discarded in red bin. Okay. Mask where you are going to discard mask, head cap and shoe cover. Can you people tell me in which bin you are going to discard mask? See, even if blood is attached, yes, it will go into blue only. Metal, it should be discarded in blue cardboard box. Okay. Now, tell me, yes, excellent. All of you people are right. All these three, mask, head cap, shoe cover will be discarded in yellow bin. Okay. All the PPE, all the personal protective equipment except your goggles, plastic apron will go into, the other things will go into yellow bin. Your mask, head cap, shoe cover, gown, disposable gown will go into yellow bin, and the gloves, plastic apron or what are the goggles, okay, will be discarded in red bin. Okay. So gloves you are going to discard in red bin. Okay. And now enoxaparin syringe, I have already told you this is an prefixed syringe, right? Enoxaparin syringe, you cannot separate the needle, so you will discard the entire structure into the PPC. It will go into PPC, puncture proof container. And next, what is this? Ceftriaxone vial. What is ceftriaxone? Whatever it may be the medication except chemotherapy, this ceftriaxone vial will go into this blue cardboard box. All the glassware will go into blue cardboard box. Expired drug, where you are going to discard this expired drug? Yes, expired drug. I've already told you in which bin you are going to discard expired drug. Excellent, Vinita. Your quick answer from Vinita, it is yellow bin. Okay. All the discarded medications, like expired medications, vaccines will go into yellow bin, no doubt. I've already told you here, right? So no doubt. So now, completed with biomedical waste management and starting with the pain scales. In last class, I have missed with the pain scales, and let me cover it here now. Okay, in peds and in adults, what are the different types of pain scales that they are going to ask in your exam? Let us see now. Okay, right. See, in peds, in neonates, in older children, in toddlers, everything, the pain scale will vary. Okay, let me start from neonates. In peds, see. Let me start from peds. Okay, see here, neonates, we have two familiar scales. That these scales, just remember, for no more details about these scales which I'll be telling you now. No need to go in depth, just remember the names, that is enough for your exams. Okay, so in neonates, remember Cry scale and YNPA scale. Okay, these are the scales that is used in neonates for pain assessment. Okay, and from 2 months till 7 years of age, you can use a special scale called R-flag scale. What is this? R-flag is revised flag scale. Okay, R for revised. Okay, revised flag scale is from 2 months till 7 years. You can use this R-flag scale, and greater than or equal to 3 years, the very familiar scale, I think all of you people know this, that is Wong-Baker Faces scale. Okay, let me write it as Faces scale. Faces scale, I think all of you know, right? Faces scale. Faces scale can be used in any children greater than or equal to 3 years of age. Okay, and for older children who can give a better response, who can give a better response, who can talk, yes, in them, for example, greater than 8 years of age, you can use a special scale called it's a very familiar scale that is used by our nursing team, that is numerical rating scale, NRS. Let me write it down, numerical rating scale. You'll just go to the patient and you'll ask, sir, just give a number from 1 to 10. So depending upon your pain, the severity of pain, just select the number. Okay, the patient will give a number. Depending upon that, you will correlate whether it is mild, moderate or severe. Okay, depending upon the patient response. This is numerical rating scale, and numerical rating scale we cannot use in less than 8 years of age, okay, or who cannot speak, right? Yes, in older children you can use numerical rating scale. Numerical rating scale is commonly used in adults. That same you can use in older children also, okay. So in neonates it is cry scale and NPA scale. These are the two scales that you should remember for your exam. And from 2 months till 7 years it is R flag scale, and greater than or equal to 3 years you can use faces scale, Wong-Baker faces scale, right? You will have multiple faces, right? Okay, the patient will select depending upon the pain. You can select the face of, okay. And greater than 8 years, the older children, it is numerical rating scale, okay. And coming to adults, okay. In adults, first see the patient is conscious or unconscious. The patient is in conscious state or not. If the patient is conscious, what scale you can use is, I have already told you, the one which is commonly used in adults is NRS, numerical rating scale, and the other one which we can use is visual analog scale, VAS. NRS and VAS is used in adults, okay. Adults, conscious patients, Wong-Baker faces, and unconscious patient behavioral pain scale. Even Wong-Baker faces scale can be used in adult patients, okay. Very familiarly used is numerical rating scale, and you also can use faces scale in adults, okay. Greater than or equal to 3 years of age, you can use Wong-Baker faces scale, okay, right. So now you can use numerical rating scale or VAS, visual analog scale, or in conscious patients even you can use faces scale. And in case of unconscious patients, yes, it is BPS. What is BPS? Behavioral pain scale. And we also have one more, let me write it down, it is behavioral pain scale, BPS, in case of unconscious patient. And we also have one more tool to assess pain in unconscious patient. It is called CCPOT. What is CCPOT? Is critical care pain observation tool. So these are the pain scales that you need to remember in peds and adults, okay. So in adult, if patient is conscious, you will just go and ask them to rate the pain, okay. So okay, then you will correlate it to mild, moderate, and severe. That is numerical rating scale or visual analog scale in conscious patients. And whereas in unconscious patient, it is BPS, behavioral pain scale. One more scale which we have, unconscious patient, if you want to remember you can remember, otherwise not. CCPOT, critical care pain observation tool. These are the pain scales which will be generally using in case of children and adults, okay, right. Now so now fall risk assessment. So patient fall risk assessment, who are at high risk of falling down from the bed, this is fall risk assessment. For that also we have a scale. The most commonly used scale is Morse fall risk assessment scale. The one which is most commonly used is Morse fall risk assessment scale. And this Morse fall risk assessment scale, it will range from 0 to 125, okay. 0 to 24 is no risk, 25 to 50 is low risk, greater than or equal to 51 is high risk, okay. No risk, low risk, high risk, okay. Morse fall risk assessment, again this is very important, this can be asked in your exams, okay. This is fall risk assessment, okay. So pain scales, fall risk assessment I have discussed, and Braden scale I have already discussed in my the previous class. The Waterloo scale, Norton scale, the other scales for assessment of pressure ulcers, I have discussed it in my previous class, okay. From these scales, yes, at least one scale you are going to get. It may be from pressure ulcers, or it may be from pain, or it may be from your fall risk assessment, whatever it may be, you are going to get one from these topics, okay, right. So now coming to IV fluids, okay. IV fluids, I think you are the one who is completely, you are the one who will be handling completely this IV fluids, right? So IV fluids should be familiar, it should be on your fingertips, okay? So right, so what are the different types of IV fluids that which we have? Yes, what are the different types of IV fluids that which we have? Yes, tell me what is the yes, no, okay, let me tell you. So whenever anybody asks you what are the different types of IV fluids that are present in your ward or whatever it may be, what are the different types of IV fluids, if anybody asks, then the next answer from your side should be crystalloids, colloids. So what are all, now tell me, what are all the IV fluids that you will usually see in your ward or ICU, whatever it may be? See, you will see crystalloids, you will see colloids, you will see blood and blood products. Blood and blood products. Right? Okay. And in crystalloids, now tell me isotonic, hypotonic, hypertonic. Okay, in crystalloids, yes, we have isotonic solutions, we have hypotonic solution, and we have hypertonic solution. Okay, so what are all the isotonic solutions? Everyone are very familiar with this. Normal saline, 0.9% normal saline is an isotonic solution, and apart from that, your Ringer lactate, that is your Hartmann solution, which is also called as Hartmann solution, is again an isotonic, right? And one more fluid that you need to remember in isotonic is plasma light. Plasma light, small chota sa bag aata hai, right? So right, the plastic bag which you will get, that is that is also an isotonic solution. Okay, right. Now, what are all the hypotonic solutions? Tell me, what are all the hypotonic solutions that usually you see in your ward? Tell me. Yes, isotonic. Okay, now tell me hypotonic. Yes, somebody told, yes, it is 0.45% NS. Okay, half strength of normal saline, yes, it becomes hypotonic. And D5, dextrose 5% in water. Dextrose 5% in water is also a hypotonic solution. You people will confuse it whether, so even I used to confuse during my student days whether D5W, that is dextrose 5% in water, is an isotonic or hypotonic. See here, I want all of you to write this point in your notes. See, dextrose 5% in water, when you administer it, initially when you are administering, D5W is an isotonic. Okay, it's an isotonic fluid. But whenever it enters into the body, this dextrose will get metabolized in your body, and then that fluid becomes hypotonic. It will act as an hypotonic fluid. Once the dextrose get metabolized, it will act as an hypotonic fluid. So finally what it is becoming? It is becoming hypotonic, right, inside our body. So consider it as hypotonic solution only. Okay. So initially it is isotonic, but whenever the dextrose is getting metabolized in your body, it becomes hypotonic, right? So yes, finally what is the product? It is finally what is the action? It is hypotonic, right? So consider it as hypotonic solution. Okay, right. So what are all the hypertonic fluids that which we have in our wards? Yes, 3% normal saline and your DNS, dextrose, normal saline, all these are hypertonic solutions. Okay. Now coming to colloids, what are the different types of colloids that are available? Yes, human albumin, hemicell, and dextran. Do not confuse the dextran with iron dextran, that's different, and this different. Okay, dextran. So these are the colloids that are usually available in our area, right, clinical area, right. So now coming to fluid of choice, now you people are going to answer this for me. What is a fluid of choice in case of hypernatremia? What is the fluid of choice in case of hypernatremia? What is the time now? Okay. Tell me, what is the fluid of choice in case of hypernatremia? Yes? Let me see who is going to answer quickly. Fluid of choice in hypernatremia. Albu, which one? Hypotonic, hypotonic. Which one you are going to give? Yes, hypotonic. The one, which one you are going to give? Hypernatremia, yes, it is N by 2 5% dextrose. N by 2 5% dextrose. Yes, it's a hypotonic fluid. It is given in case of hypernatremia. Okay. Okay. In exams, if they give in options, if they have given 5D, N by 2, N by 3, N by 4, whatever it may be, first select the option N by 2 5% dextrose for initial management of hypernatremia. Usually it's N by 2 5% dextrose. Okay. Yes, it's N by 2 5% dextrose. That's the fluid of choice in case of hypernatremia. Okay. And what's the fluid of choice in hyponatremia? Nagamani Arjula is telling 3% NS. Quickly answered, you are right, it is 3% NS, which is a hypertonic solution that you are going to administer in hyponatremia. Okay, right. So what is the fluid that your fluid of choice in decay? If a patient comes to you in decay, diabetic ketoacidosis, what is the fluid of choice? Yes, excellent Nagamani, it is 0.9% normal saline. And what is the fluid of choice in case of vomiting? If any patient comes to you in vomiting, yes, what is the fluid that you are going to start to correct that dehydration? Yes, excellent, it is normal saline again, 0.9% normal saline, which is an isotonic fluid, right. Next, coming to diarrhea, if any patient comes to you in diarrhea, yes, tell me, in diarrhea, excellent, yes, Renu Raj, Ravuri, Venela, Vinita, Navyasri, Vijaya, yes, you people are right, it is RL. Okay. Why RL in case of, why not NS and why RL in case of diarrhea? See here. Let me, for this I need to explain you a small concept here. This is very important also. In diarrhea, if any patient comes to you, you will start with RL, your Hartmann solution. Why? Because see, in diarrhea there is intestinal fluid loss. What is there in intestine? Soda bicarb. All the bicarb that is base is lost from your body, and the one which is left over in your body is acid. So there will be acidosis, metabolic acidosis in diarrhea. So if you give RL in that patient, okay, this RL, ringer lactate, this lactate, it will go and get metabolized in the liver into soda, that is bicarbonate. It will get converted into bicarbonate in liver. Okay, so usually what do we give to in acidosis? It is soda bicarb, right? So that is what is happening here, right? So if you give RL, yes, finally bicarbonate is getting produced in the body and it will correct the dehydration. Okay, so that's how, right. That is what the concept behind giving RL in diarrhea. Now in case of burns, in adults, what do you give? What do you give in burns in adults? Yes, RL, no doubt, right? So in case of peds also it is RL, plus you will add some sugar solutions, 5D, 5% dextrose. You will add 5% dextrose also in peds. Sugar solutions should be added. And one more important IV fluid that we are going to give in this burns patient is, whenever you go to burns ward, they'll be ordering maximum for FFP. I've already told you in my last class, right? We also administer, since there is plasma loss in burns, right? So you will also give FFP, fresh frozen plasma, in case of burns. Okay, right? If they're asking you fluid of choice is RL. Do not confuse. I'm just saying, okay, so for the plasma loss, you'll also give FFP in case of burns. You need to give FFP actually. Okay, so RL, and in PEETs again it is RL. For in PEETs you will specially add some sugar solution 5D there. Okay, right. So next, coming to shock. See, whenever anybody asks you, any question is asking you what is the initial fluid that you are going to start as a nursing officer in case of shock, or in case of resuscitation, if you are resuscitating a patient, what fluid you will start with? Close your eyes and answer crystalloids. Okay, in hypovolemic shock, yes, it is normal saline, and in resuscitation, yes, again it is normal saline. Okay, it is normal saline. Initial phase of resuscitation or shock, whatever it may be, if the question is asking you, close your eyes and answer for normal saline. Even if they have given colloids in the option, please do not select colloids. Please don't select colloids. Okay, since the colloids has higher molecular weight, so we can start with colloids. No, it's not like that. Colloids cannot be given in acute phase of shock. In acute phase of shock, my dears, kindly remember, in acute phase of shock, colloids are contraindicated. Okay, it's contraindicated in acute phase of shock. Okay, the one which you can give is crystalloids. Okay, and the one which fluid can be given with blood transfusion. Along with blood transfusion, which crystalloid can be given? Excellent, Vinitha, it is normal saline. The one which can be given along with blood transfusion and which cannot be given with blood transfusion, which can be given with blood transfusion is normal saline, which cannot be given along with blood transfusion is RL. Okay, you will never administer RL along with blood. Okay, you can give NS along with blood, but you cannot give RL with BT. Okay, right. So next, starting with one more important topic, that is parenteral nutrition. Okay, this is very important again. Okay, let us start with parenteral nutrition. Okay, see here. What is parenteral nutrition? It is parenteral nutrition. Okay, other than enteral, that is other than GIT, you are going to give nutrition. Other than GIT in the sense, how you are going to give? Via the intravenous route. It is given via the intravenous route. Okay, IV route. When I say intravenous route, you can give, either you can give by central vein or peripheral vein. Okay, you can give it either by central vein, via the central vein also you can give, or peripheral vein also you can give, right? So whenever you give parenteral nutrition via a central vein, it is called as total parenteral nutrition, TPN, total parenteral nutrition. So whenever you give parenteral nutrition via the central vein, it is called as TPN, total parenteral nutrition. If you give parenteral nutrition via the peripheral vein, it is called as PPN, peripheral parenteral nutrition. Okay, and most of you people will confuse TPN, PPN are same. No, it is not same. TPN is something, it is given via the central line. PPN is something given via the peripheral line. Okay, so no doubt in that, right? Okay, so what is the best way of giving? Here they are asking you what is the best way of giving parenteral nutrition. Okay, the best way of giving parenteral nutrition is via the central line. Via the central line. Okay, when I say it is central line, that means I am talking about TPN, right? So TPN is best or PPN is best? TPN is best. Central line or peripheral line? Central line is best. Okay, right. So now CVC used for prolonged TPN. For example, if you want to give a TPN for a prolonged period of time, which central line you will be selecting? Now you people should answer. I have told you many times in my classes, in my previous classes. Now you people are going to answer for this. which central line you are going to use. I know it is central line, I've already mentioned it here. Which central line? There are different types of central line, right? So what is that central line that you will be using for prolonged TPN? I'm not asking you the site, I'm asking you which CVC you will be using. I've already told you, right? Hickman catheter, which is also called as tunneled cath, right? Why? For prolonged TPN, you need to give it via the Hickman cath or tunneled cath, because there is decreased risk of sepsis with this Hickman cath or tunneled cath. That's why tunneled cath need to be used for your prolonged period if you want to give TPN. Okay, right. Next, what is the best site for CVC insertion for administering TPN? Now answer SVC. Okay, SCV, subclavian vein. Okay, now answer SCV, subclavian vein. Best site, I've already told you in my previous class, best site for TPN administration, okay, it is SCV, subclavian vein. Okay, right. So how often TPN bag need to be changed? As a nursing officer, yes, this should be always in your mind. How often you will change the tubings, TPN bag, everything. All the tubings need to be changed along with TPN bag. So how often you will change it? How often you will change it? These questions can be asked in your exams. Every 24 hours. Yes, once in a day. Once in a day you will change. You should change the entire tubings along with the bag. Okay. Anything is left over, you will discard it. Okay. So TPN is given via the dash lumen in central vein. So there are 3 lumens in central line, right? So medial, distal and proximal. Which lumen is used for, which port is used for TPN administration? Which port is used for TPN administration? It is again very, very important. Yes, excellent Vinita, it is medial lumen is used for TPN administration. Okay, right. Usually, if you have seen TPN bags, have you seen TPN bags? Have you seen TPN bags? Yes, usually we get 3-in-1 chamber bags. There is 3 chambers, right? 1, 2, 3, 3 chambers, right? So 3-in-1 chamber bag usually you will be getting, and you will mix it before administering it to the patient. By you will just twist the bag in all the directions. You will scroll it and you will mix all the solutions, and then you will administer it to the patient. Okay, this is 3-in-1 chamber bag. It has protein in it. Okay, it has protein. 3-in-1 in the sense, one chamber is for protein, another chamber is for lipid. The white emulsion which you are seeing here, this is lipid emulsion, fat. Okay, so protein, lipid and carbohydrates. Okay, these are the 3 chambers. One chamber is for protein, other chamber is for lipid emulsion, another one is for carbohydrates. Okay, the ratio is 20:30:50. So this is the ratio. Okay, so 20% of protein, 30% of fat and 50% of carbohydrates are present in this TPN bags. Okay, right. Okay, so see here, how much TPN is given in 24 hours. Yenta fluid ivochu manam in one day. How much TPN can be administered is, it is 1 to 2 liters per day you can administer in case of TPN. Okay. And one more question, the most common complication of TPN. See, the most common complication of TPN is hyperglycemia. You are directly giving carbohydrates into the vein. Yes, it can cause hyperglycemia. Okay. Parenteral nutrition, yes, the most common complication is TPN, hyperglycemia. Okay. And what is the cause of death in case of patients getting TPN? Those who are getting TPN, what is the cause of death in them? What is the cause of death? Can anybody tell me? Let me see who is going to answer. Yes. Cause of death, let me see who will answer. Overload, blockage, whatever it may be. So it is cardiac arrhythmias. Okay, it is arrhythmias. Cardiac arrhythmias. Okay, cardiac arrhythmias is the most common cause of death in patients getting TPN. Okay, right. See, what are all the complications that you are going to see in a patient who is getting TPN is, I want all of you to remember these complications. Complications, I am writing it down here. Complications is very important. Complications of TPN. Okay. So, whenever you start with, whenever you give large volume of nutrition in any patient who is chronically malnourished, okay, who is chronically malnourished and suddenly you are giving large quantities of fluids, nutrition, yes, it can cause electrolyte imbalances in the patient, which is called as refeeding syndrome. Refeeding syndrome. Okay, where you are going to see electrolyte imbalances. Mainly, the first main clinical sign of refeeding syndrome, very, very, very important. The first main golden sign is hypophosphatemia. Hypophosphatemia. Okay, this is the first main clinical sign or the golden sign of refeeding syndrome. Okay, and apart from that, potassium, magnesium, calcium also will go down, but the one which you need to remember is this hypophosphatemia, which is a golden sign of refeeding syndrome. Okay, right. And since you are giving fluids directly into the body, into the circulatory system, yes, it can cause circulatory overload. Even refeeding syndrome can cause cardiac arrhythmias, even circulatory overload can cause arrhythmias. Okay, whatever it may be, cardiac arrhythmias will be the cause of death in patients getting TPN. Okay, so and apart from that, you are administering TPN for prolonged time in IV route. Okay, so it can also cause sepsis, right? It can also cause sepsis. So these are all the complications of TPN. Okay, circulatory overload, refeeding syndrome, sepsis, right? And see, this 3-in-1 chambered bag, I've already told you, right? It contains this 3-in-1 chamber bag, I told you, right? It contains lipid, that means fat. So directly you are giving fat into the body, right? Fat emulsion into the body. So it can cause hypertriglyceridemia. Okay, hypertriglyceridemia. Okay, you need to monitor for lipid profile also when the patient is on TPN. Okay, if lipid levels are going high, then you need to withhold the lipid emulsion. Okay, so these are all the complications that you need to remember. Okay, in case of TPN, right? So I think today's class is still here only, right? Yes, all the complications I have discussed, and yes, so there are many exams, and even one more exam, I think GMCH, that's also GMCH Chandigarh, they are also going to release notification by this month. Okay, by this month you will also get that notification also. So there are many things on your plate. Okay, so at least if not one, other one you can crack and enter into that and get settled. So I want all of you to apply for the exams, apply for all the exams, NORCET, ESIC, whatever it may be, apply for that exam, and do prepare and do watch my videos, and do share it to all your friends who are preparing for central exams. And see you very soon in one more interesting topic. Few topics are left, few nursing procedures, few important images are left from my side in FON. Let me cover it in one more video. With one more class, I will complete the other topics which are left from my side. And so నార్సెట్కి అయితే చాలా తక్కువ టైం ఉంది అండ్ స్టార్ట్ ప్రిపేరింగ్, గివ్ జీటీస్, యాజ్ మెనీ జీటీస్ యాజ్ పాసిబుల్, గ్రాండ్ టెస్ట్ ఇవ్వండి. ఓకే, అండ్ డూ యాజ్ మెనీ రివిజన్స్ యాజ్ పాసిబుల్, కంప్లీట్ సిలబస్. నేను ఆల్రెడీ టాపిక్స్ ఏవేవి చదవాలనేది అప్లోడ్ చేశాను నేను. సో ఏదైతే అప్లోడ్ చేశానో అట్లీస్ట్ వాటినన్నా కవర్ చేసి వాటికన్నా నోట్స్ ప్రిపేర్ చేసుకోండి. నోట్స్ ప్రిపేర్ చేసుకున్న తర్వాత రివిజన్స్ ఇంపార్టెంట్. రివిజన్స్, ఎంసీక్యూస్, గ్రాండ్ టెస్ట్ ఆర్ వెరీ వెరీ ఇంపార్టెంట్. These three are very important. It will create, it is going to create miracle. Okay, these 3 steps are going to create miracle, remember. Okay, so if you have any doubts, you can just text me on my Instagram handle, or you can just text me on my Telegram. And do support the channel Medicine Nursing. Do watch the videos, share it to all your friends who are preparing for exam. Content is same everywhere. Okay, so if I'm teaching for NORCET, it does not mean that I'm not teaching for ESIC. Okay, content is same everywhere. Airway management is same for ESIC students, and so patient is same, right? In ESIC hospital or AIIMS hospital, same. Okay, and ఈసారి UPSC కండక్ట్ చేస్తాను మీ ESIC ఎగ్జామ్స్. Okay, so first time UPSC is conducting, right? I don't know how they are going to ask, in what pattern they are going to ask in your exams, but yes, for all the worst situations you need to be prepared. Okay, and right, so all the best for your exams. So let me one more video is pending from my side apart from these classes. The general video which is pending is the ESIC time planner. So yes, study plan I'll give you for ESIC, those who are preparing for ESIC. But a sincere advice from my side is to apply for all the exams. ఏవేవైతే ఎగ్జామ్స్ రిలీజ్ అవుతున్నాయో, ఏవేవైతే నేను నోటిఫికేషన్స్ మీకు సెండ్ చేస్తాను టెలిగ్రామ్ ఛానల్లో, వాటికంతా అప్లై చేయండి. ఏదో ఒకటి రాకపోతే ఏదో ఒకటి ఖచ్చితంగా వస్తుంది. సో యూ కెన్ గెట్ ఈజీలీ సెటిల్డ్. ఓకే, సో all the best for your exams. Okay, see you very soon in my FON part 3. Okay, okay, thank you Shraddha, thank you Navya, thank you Divya, Mohan, Vinita, Prashant. Thank you so much for attending my class. And see, I have a problem in sharing my PDF. Actually, it is getting shuffled. All the images and matter is getting shuffled, so I couldn't able to share notes PDF. And do take screenshots at least, if you could not write make up the notes. Okay, so do take screenshots at least. Like there is a some technical error going in my tab. Okay. Thank you all. Thank you so much. Any doubts? Yeah, thank you Likit, thank you Bhagyarada, thank you so much. Okay, yeah, sure Vanilla, sure. Okay, Divya Mohan, thank you so much. Okay, so do like, don't forget to share this video to all in your groups. And if you want any other topics from any other subjects also, do comment it down in just below this video. Let me I'll make sure that I'm covering it. Okay, in forthcoming classes. And all the best once again from my side. See you. Bye bye guys.